Hi, I'm Dr. Cassi from NAVC's Vetfolio and the host of Vet2Vet. If you think you know what the risk of heartworm disease is in your region, you may be surprised. This potentially deadly parasite is spreading to new regions of the country each year, and it's more important than ever for us to make sure we're educating our clients about that. Today, we're joined by Dr. Destiny Coleman. Dr. Coleman is a graduate of the UPenn Veterinary School and has a passion for preventative medicine in dogs and cats. We have that in common. So, Dr. Coleman, thank you so much for joining me.
Hi, Dr. Cassi. Thanks so much for having me on the show today. I'm really excited to be here to talk with you guys about the risks of heartworm, flea tick, and intestinal parasites for our fellow veterinarians and their patients.
Absolutely. And I'm so glad we're talking about this because as veterinarians, of course, we know that heartworm disease is an important issue. It's a serious medical issue if our patients do contract heartworm disease. What does recent information show about the incidence of heartworm disease in the US?
Yeah, so I think that, our go-to when we think about data on heartworm disease is going to be the American Heartworm Society. And their latest incidence map is going to show us that there's an upward trend in overall heartworm infection rates. But when we look closely at this, the concern is that there's an increase in cases in the hotspot areas that we think about traditionally, like the Mississippi Delta region. But there's also an alarming increase in cases in areas that we wouldn't normally consider hotspots. So overall, we're seeing an increase not only in the number of cases in each geographic area, but also in the areas where we're not used to seeing as much heartworm disease. So we're seeing increases all around.
I would say that definitely echoes what I feel like I'm seeing clinically. I do feel like I'm treating more heartworm cases now than I have in the past. What types of regions are you seeing heartworms in now that you haven't seen heartworms in before?
So we're seeing a great increase up in the Northeast. So a region that's easy for me to point out is the Connecticut area. So I typically have practiced in the Northeast, not necessarily in Connecticut, but Pittsburgh, Northern Virginia, areas like that. And in Connecticut, I wouldn't traditionally say, hey, that's an area that I have a major concern for heartworm disease. And then also there's interesting pockets of heartworm disease in Ohio, which also we don't think of as a typical hotspot for heartworm disease for these dogs.
It's interesting that, you say you're seeing pockets of heartworm disease because I would imagine that if they're pockets of disease, they probably won't remain pockets for very long since it's so easily spread.
Yeah, and I would think the concern is, right, once we kind of can establish heartworm disease somewhere, we can then establish it in the mosquito population and the wildlife population. And that wildlife plays a really big role in the transmission cycle of heartworm. And those wildlife we know don't tend to stay in one area forever, and they can continue to spread as well. So it's not just the mosquitoes.
Absolutely. And that leads into kind of my next question here, where we know we have so many options out there for the prevention of heartworm disease, yet we're seeing this increase in prevalence and distribution. I have my own kind of theories that are not necessarily backed up as to why this could be, but why do you think we're seeing this increase in the prevalence and the distribution of heartworm disease?
There's a couple of issues. So again, referring to the wildlife population, one of the really big populations that I don't think people consider a lot is the coyote population. So in some areas where they looked at prevalence of heartworm disease in coyotes, just as one example of that wildlife that can serve as such a good reservoir, they'll have 2/3 or more of the coyotes that are positive for heartworm disease. And coyotes, unlike deer, right? For deer, I think we keep track of their populations a lot, but coyotes aren't really tracked as we might for an animal like deer. If they're sharing a population of mosquitoes with your dog in your backyard, we have a high risk of being able to transmit heartworm infection. The other big thing can be transportation of heartworm positive dogs. The South, where we have the most incidence of heartworm disease, unfortunately also has a big issue with unhomed dogs, right? And so we tend to bring them around the country and share them with other areas that have maybe space in the shelters or rescues that can take them. And not all these shelters can always test the dogs first. Of course, we know there's a big pre-patent period before they might even show up positive on a test. So there's a lot of reasons that a positive dog, before any treatment is initiated, might be transported to an area where typically we have a low heartworm incidence. Another thing that we think about are we have increased cases, right? So we're talking about this increased prevalence of heartworm disease. However, we're not increasing compliance rates. So it's not technically a global warming answer, a wildlife answer, a mosquito answer, but we're kind of doing the same thing we've always done in terms of how well and how frequently we're educating pet owners on heartworm disease and heartworm prevention. But with increased cases, we've failed to improve compliance rates. We're not protecting all of the dogs exposed. So working on that education is going to be another part of this conversation, just to make sure that we can kind of keep up with the incidents and making sure we're talking about the risk factors for these pet owners.
I think you answered a lot of questions there. That was really helpful. I kind of was thinking about the dogs being transported with being heartworm positive, and was thinking, why aren't we necessarily testing, and why would we move these dogs into these areas? But you make some really good points about, maybe they don't have the resources to test, or what if it's in the pre-patent period and they're negative when they test them, and then all of a sudden we're transporting them, and a few months later they come up positive. The coyote population makes a lot of sense, and it certainly speaks to why we see it so much here in Florida. I kind of joke that mosquitoes are our state bird here in Florida. And certainly, at least in North Central Florida, we have a ton of coyotes. So, yeah, it seems like the answer here really lies in compliance, because the disease itself is out there, the parasite itself is out there. One other possible reason for increased prevalence that I just want to ask you about is macrocyclic lactone resistance. We've heard a little bit about that. Are we seeing macrocyclic lactone resistance?
So macrocyclic lactone resistance is well documented, but I do want to elaborate on that. Even though it has been documented and we have some data on it, it is still considered to be a very rare and pretty restricted to the Mississippi Delta region. So it's not a widespread macrocyclic lactone resistance that we see throughout the entire country. It's particular isolates of heartworm that have developed this resistance. So to build on that, though, right, we think about resistance, and anytime we think about resistance, I personally get worried, hey, this is going to spread and it's going to spread rapidly. But the macrocyclic lactone resistance hasn't seemed to do that. And in a recent article in AHA by Dr. Pulaski, she's a clinical assistant professor and director of diagnostic parasitology lab at the University of Georgia College of Vet Med. She's followed trends in resistance of parasites to commonly used preventatives and anthelmintics. And thankfully, she's actually seen an overall decline in the number of cases of heartworm disease that is resistant to commonly used preventatives. So it doesn't seem like it's spreading rapidly, and that it's something that we need to kind of go into panic mode over. What we do know is that most importantly, and the biggest problem that we face in the industry, is actually a lack of compliance. So regardless of if there's isolates that are resistant or susceptible to the class of drugs, the macrocyclic lactones, there's a data point that I want to share with you that I think is really profound. That's a way bigger deal than the small, rare occurrence of resistant isolates. And that's that 68% of dogs leave a clinic without any heartworm disease prevention. So that leaves us with the remaining percentage of dogs who leave with somewhere between 1 and 12 doses. So still not necessarily saying that they're fully compliant. And then, of course, we have the population of dogs who don't even go see the veterinarian routinely, and they're not even included in this statistic. So to me, compliance is going to be something that we need to focus on before we focus on resistance to the class of drugs.
I would agree with you. That echoes what I'm seeing in the clinic as well. With it's certainly not a consistent leaving with 12 months of heartworm prevention every time. It's let me get 1 and I'll come back next month. Let me get 3 and I'll come back. And some people absolutely do. But, I tend to tell people, if you're anything like me, then, it will be here this time next year. And you'll be like, how has a whole year passed?
Oh, yeah, it happens quickly, doesn't it?
Yes, it's easy to lose track. So before we jump into compliance, because of course this is a major issue, Let's talk about the molecules real quick. What is the molecule that's used for heartworm disease prevention in NexGard Plus, and why this molecule?
Yeah, so for NexGard PLUS, the company chose to use moxidectin, which is another macrocyclic lactone, in an effort to sort of diversify the heartworm disease prevention portfolio. The moxidectin does fail the least against the rare resistant isolates. So in studies, we can see when comparing macrocyclic lactones that moxidectin does the best job against resistant heartworm isolates. For any non-resistant typical isolate, a single dose of moxidectin is nice and effective as well as any of the other macrocyclic lactones. But we do know that for resistant isolates, moxidectin works the best, but it also works even better when given multiple months in a row. So that's an important part as well, and just reinforces compliance. One thing I will note is that various doses of moxidectin were tested against the JYD34 resistant isolate for the development of NexGard Plus, but we did not test the final product against resistant isolates at this time.
Sure, and that makes sense. And there are, different products out there that use moxidectin, and like you said, it's been shown to be effective. And I know, at least for me, thinking about NexGard Plus, I feel good knowing that there's moxidectin in there for heartworm prevention, just with the knowledge that there is some resistance to macrocyclic lactones out there.
Yeah, sure, of course.
So switching gears a little bit here, let's talk about ticks. I have nothing nice to say about ticks.
No,
They're
they're
awful.
just good at being parasites.
They
That's all that we have them for.
Exactly. They're good at being parasites and not a whole lot else, and good for making the rest of us out here sick. So I guess my question would be, what is the current state of ticks in the United States? I know at least here in the Southeast, there is an abundance of ticks and tick-borne diseases, but what are we seeing throughout the rest of the United States, and what do pet owners need to know?
Some things that I'll point out is that we do have an expanding seasonality and geography for some of our established ticks, like the Lone Star tick and the black-legged tick. So this means that we're having more dogs exposed to the pathogens that they carry. We are seeing, secondary to global warming, this expanding geography, secondary to the movement of their hosts and the expanding regions for deer, birds, you name it, right? So they're spreading. There's more ticks in more areas, meaning there's more tick-borne diseases in more areas. Another thing that I really like to point out here is that I think there's a really big misunderstanding of what we'll call seasonality or risk, depending on the calendar. The average pet owner probably isn't using 12 months of flea and tick protection every year. And so oftentimes in the Northeast, especially, what I'm seeing is that they'll stop administering in October. And a good example of them not understanding the seasonality of ticks is they think that they're so common in the summer months. Whereas a really major tick, the black-legged tick, that's going to transmit Lyme disease to their pets or to them, is really active into the late fall, so way past October 1st. And so we can see these black-legged ticks out questing any day that the temperature is above 32 degrees Fahrenheit. So if the temperature breaks up over 32 degrees, we're going to see these ticks out and about looking for a meal. So my take-home message to pet owners is that we may not need protection every day of the year, but we definitely need it every month of the year, because even up in the Northeast, we have plenty of days that are 40, 45 degrees, sometimes even more, which is fun in February. And those are months that we tend to see pets not protected.
Absolutely. I mean, we even hear that down here in Florida of like, oh, not so much in the winter. And we certainly get days under 32 degrees, but very rarely does it ever stay under 32 degrees. So
Yeah,
that's a
absolutely.
really good message to say, even if it's cold outside. 32 degrees is, especially here in Florida, you're not going to have really then they would need protection every day of the year.
Yeah. Yeah, you guys are probably pretty close to meeting it every day of the year down in Florida.
Yes, absolutely. So then let's talk about tick protection in terms of NexGard Plus. Can you talk about NexGard Plus and the tick protection that it offers and what we need to know about it?
Yeah, so something that I love, right, as somebody who obviously talks about NexGard, afoxolaner, NexGard PLUS a lot, is that going from afoxolaner in NexGard, where it's already been, right, so widely used, so trusted and reliable, is that we're able to use the same dose of afoxolaner in NexGard PLUS. So we're able to transition that right over. We didn't make any modifications, increase the dose, lower the dose. So it's a nice trusted dose and efficacy that veterinarians and pet owners already know and expect. Another key thing about NexGard Plus is how easy is it to give? So the ease of administration, because it is a soft beef flavored chew, really makes a difference. So we can't protect against ticks if a dog won't take a product readily and willingly. So if they're not willing to take it, that becomes a big hurdle for pet owners. And we don't want to have that battle once a month when we're trying to give a product. So having a chew that's well accepted by the dogs is really nice. In addition to that, something I always found to be a hurdle in practice with any medication is that we really lose control of prescription instructions as soon as they're sent home and they walk out the door. So for NexGard Plus, it does not have to be given with food for the efficacy of the product. So for me, this is really relatable because I remember to give my dogs their doses of medications or preventatives whenever I remember. So I'm usually triggered by the changeover of the month, which is really helpful, but it doesn't necessarily correlate with mealtime. And so if I can't just give it whenever I do remember, and I have to say, okay, I'm going to remember to give it in 5 hours at dinner time, then it inevitably becomes delayed to the next day or the next day or the next week, because I have to then try to remember again. And in a busy schedule, that just gets really complicated.
I can relate to that so much. I've had that battle with myself of like, inevitably, it's like in the middle of the day when I'm not typically feeding my dog. And yeah, and it's like, gosh, I hope I remember at dinner time. And I'm the same. I don't always. And so I think that is a big advantage to say not having to give it with food. So when it does just pop into my head, I can walk over and give it and not have to think about, okay, can I remember it this evening or tomorrow morning or something like that.
Yeah, absolutely.
So for me, when I'm talking to owners about parasite protection, I like to talk about what I call 4-quadrant coverage, meaning I want the pet to be protected from heartworm disease, fleas, ticks, and intestinal parasites. And I think we've talked a little bit here about heartworms, fleas, and ticks. Does NexGard Plus also protect against intestinal parasites?
Yeah, of course. So this is a great 4-quadrant coverage combination product, if you will. So NexGard Plus is going to offer protection against hookworms and roundworms, some of the most common intestinal parasites diagnosed, which you can see from the Cassi website or studies like the dog park study that show a decent prevalence in our dogs for the roundworms and the hookworms.
That's another big one that we deal with down here in the Southeast. I blame the warm weather, but from what I understand, intestinal parasites and concerns about, hookworms and things like that are not limited to the Southeast. So being able to cover all of those major parasite groups, I think is just essential for whatever we're prescribing or recommending.
Yeah, definitely. We love to have that ability to do the combination product with NexGard Plus to do that true 4-quadrant coverage.
Absolutely. So circling back around to the compliance that we talked about earlier and both admitted that we maybe sometimes struggle with ourselves, even as veterinarians, talking to owners about this, there's no doubt about it, how important it is to relay this information, but owners can have a lot to absorb during a wellness visit, vaccines and spay neuter and diet and on and on and on. And if there's anything wrong with their dog, making sure we're talking about that. Can you offer some tips during that wellness visit to help effectively communicate how important it is to keep pets on parasite protection and how to kind of make that message stick in, I don't want to call it the noise because it's all important, but in all of the information that owners are trying to absorb?
Yeah, definitely. So I think this is a really big hurdle, especially for those of us who do general practice or wellness care. So one thing that I find is really important is we often assume that pet owners have already been educated. Say they have a 5-year-old dog, you're going to assume in those 5 years they've already been educated on what heartworm is, what the risk is, fleas and ticks, intestinal parasites, that they need protection. But I think we need to make sure that we're always checking in to know that they actually understand. So an example of a big gap in knowledge is if we take the time and we say, hey, are you on heartworm prevention? And they go, oh, well, I brought in a fecal sample. My dog doesn't have any worms, right? There's so many pet owners who really think that heartworm disease is an intestinal parasite. It's just a heart-shaped worm. It's still in the intestinal tract. They're just going to get a dewormer if they were to become positive. So making sure there's an education on the parasites and the need to give protection against each of them at every wellness appointment it's really important, but I also understand it's a really big lift. So this is a great use of a technician's skills and knowledge. It doesn't necessarily have to take up doctor time, although I do think the doctor should briefly acknowledge and reinforce that they recommend protection, and then the tech can always expand on the information. So that's one thing. Another hurdle that I see is when a clinic carries many products and they don't have a strong unified recommendation. So maybe the receptionist really likes one product, but the doctor in the room has recommended a different product and the technician says, whatever you want, this one's the cheapest. And then we tend to see that the pet owner will leave without actually picking something, and they're going to think about it. And so ultimately they might leave with more questions than they started with. So having that unified recommendation or a simplified recommendation within a clinic through all levels, I think can be really helpful. The third thing that I really love is having visuals around the clinic that are educational. Might be wall frames, flip books. A lot of clinics now will have a TV with material playing on that. So I think that can be really helpful because we do know we have such little time in these wellness appointments that we have to make sure we can get as many touch points as possible for these pet owners. So it might take some of the burden off of us if they've just educated themselves on heartworm disease while they waited in the lobby. And finally, we might not have time to effectively communicate to each pet owner about all 4 quadrants of protection, right, that we just talked about. But that can be a benefit of prescribing a combination product like NexGard PLUS. As the veterinarian, we can still have the confidence that that patient is covered for each of those quadrants, even if we ran short on time or a message didn't get delivered or the pet owner didn't retain all of the information. We at least know for our sake that we've covered all 4 of those quadrants with the product that we've prescribed.
I think all of those are great recommendations. I absolutely agree. Having that familiarity with, what's going to work best for your clientele, your clinic, and making that unified recommendation so that pet owners aren't confused, making sure that the whole staff is educated on the differences between the products and why you're making the recommendations that you are. And then, yeah, absolutely having those visuals up around the clinic. I mean, those can cause the pet owner to ask the question. So even if you're caught up talking about something else, they can say, oh, but I saw this poster and it said that heartworm disease is transmitted by mosquitoes. I didn't know that, which I actually was asked the other day. They said, well, how is heartworm disease transmitted? And it was somebody who I absolutely thought we had had this conversation before. And maybe we had, but we probably had a whole bunch of other ones too. And that had gotten lost in all of the other information. So re-emphasizing the importance of, hey, these parasites are out there. They're easily transmissible. They're a danger to your dog and then certainly to humans in some cases. And just reinforcing how important it is to keep those pets on protection, just assuming the owners already know, I think is really good advice.
Yeah, definitely. I think it's really important to remember that in the clinic, we're all veterinary professionals. And so we have such a high priority for the veterinary medicine topics that we talk about, but it doesn't necessarily mean that it's the highest priority for a pet owner to remember. So to me, if you tell me that a disease is spread by mosquitoes that affects dogs, right, I'm going to say, hey, that's really important fact. I'd like to remember that. That's really relevant to me. But to a pet owner, that might be the last thing that they were worried about during that appointment, and that might not be information that they retain. So making sure that we're doing the education every time is just so helpful to reinforce because we never know what their priority was at the last appointment or what education they got from another clinic or if they've even been to a clinic before.
I think that's such a good reminder. It's, I think, something that many of us know, but when you get busy in the day, it's hard to remember that. And it's always good to bring that top of mind to say, hey, remember, make sure you're talking about this because you understand it. And this is just day-to-day knowledge for you, but that's not true for everyone.
Yeah, absolutely.
Well, Dr. Coleman, this has been a great conversation. Thank you so much for joining us and for all of the wonderful information.
Yeah, Dr. Cassi, it's been a pleasure. Thanks so much for having me on today.
And thank you to Boehringer Ingelheim for partnering with us for this edition of Vet2Vet. Check out nabcsvetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day. NexGard PLUS, afoxolaner, moxidectin, and pyrantel chewable tablets is safe for puppies at 8 weeks weighing 4 pounds or more. The most frequently reported adverse reactions reported in clinical trials were diarrhea, vomiting, lethargy, and itching. NexGard PLUS contains afoxolaner, a member of the isoxazoline class. This class has been associated with neurologic adverse reactions including tremors, ataxia, and seizures in dogs with or without a history of seizures. Use with caution in dogs with a history of seizures or neurologic disorders. The safe use of NexGard PLUS has not been evaluated in breeding, pregnant, or lactating dogs. Dogs should be tested for existing heartworm infection prior to starting a heartworm disease preventive. For more information, call 888-637-4251 or visit nexgardplusclinic.com. NexGard, afoxolaner, is for use in dogs only. Safe for use in puppies 8 weeks of age or older, weighing 4 pounds or more. The most frequently reported adverse reactions include vomiting, pruritus, lethargy, diarrhea, and lack of appetite. The safe use of NexGard in pregnant, breeding, or lactating dogs has not been evaluated. Use with caution in dogs with a history of seizures or neurologic disorders. For more information, call 888-637-4251 or visit nexgardclinic.com.